I'm Corey. This is my video about bipolar disorder for Nursing 730. And we're talking about Bob in our scenario, who was brought in by his family to see a doctor about his strange behavior or abnormal behavior. So just a brief synopsis about bipolar disorder. It's a condition that causes mood swings between very high energy and a low mood. So high energy being mania or the manic phase, and then the hypomania phase, so swinging back and forth between those two, and the low mood, which would be depression. So in the scenario that Bob's presenting with, he's in the manic hypomanic phase, so lots of energy, little sleep, fast, rapid talking, risk taking, those types of things that he's presenting with. So I chose lithium, and in simple terms, lithium is a salt, and it's one of the older drugs used for bipolar disorder. So it's a long-acting mood stabilizer, and it helps keep the mood from swinging too high or too low. It calms the brain's signaling communication signals, so that the patient doesn't feel as revved up. Lithium has a track record of reducing manic episodes and lowering suicide risk, and it also can help to protect the brain from repeated mood damage over time. How lithium works in everyday simple language, it gently stabilizes or regulates brain chemistry to steady mood. It affects certain cellular pathways to make mood shifts less extreme, and it also helps with circadian rhythms, sleep patterns that often get interrupted during the manic phase. So starting lithium, Bob would need to get blood tests to check kidney and thyroid function first, and a small dose would be started and slowly increased while watching how Bob's doing with his labs. And then Bob would need regular check-ins for a while to measure lithium levels and side effects. Common side effects for Bob to educate him about would be thirst, urinating more, a tremor, a mild weight change, or a feeling of being a little bit tired at first. So why I chose this, why it would be a good drug or medication for Bob to be on: it can reduce how often the mania cycles and comes back, or how strong the mania is. It lowers the risk of acting impulsively and making risky choices. It works across all moods, so not just the mania and depression, which can be really helpful since Bob seems to have both types of episodes. Lithium can be used long term as long as there's monitoring, and so that's fairly safe. And as far as Bob coming into the ED with signs of lithium toxicity, lithium stays in the body mainly through the kidneys. So if Bob is dehydrated, sick, or is taking medications that affect renal function, the lithium can build up in his system. And lithium toxicity is the buildup of too much lithium in the body. So let's see. When the levels get too high, it starts to alter brain and body signals, which can cause effects like tremor, confusion, balance issues, nausea, and even seizures or fainting, passing out. So lithium works best with a careful, small to moderate dose and regular labs testing for the levels in his blood. So the line between being really helpful for Bob and being harmful is the therapeutic window is very narrow. So things like dehydration, renal issues, or certain other medications, it can just tip Bob right into a toxic level. So again, regular monitoring is paramount. So what we can do when Bob's in the ED, as far as medications and steps, immediate actions, we'll need to check how high his lithium level is, check how his kidneys and electrolytes are doing, watch his vitals, maybe even stop lithium temporarily and give IV fluids, usually normal saline, to flush out the lithium from his body. If it's very high, which 2.1 is pretty significant, or if there are serious symptoms like confusion, seizures, trouble breathing, Bob may even need to have dialysis. And symptom-specific meds that can be used, medications in the ED for Bob. For his tremor, he can have a beta blocker like propranolol. For seizures, he can have seizure medication. There isn't a daily anti-toxic medication, but the goal would be to remove the excess lithium and to keep him safe. So education for Bob, we can talk to him about, to watch for toxicity, lithium toxicity signs, so this doesn't happen again. He would need to watch for a new tremor or confusion, dizziness, vomiting, severe tiredness, or muscle weakness. Staying hydrated is super important, and keep his other salt intake in his diet low. And especially all of these things, if it's hot outside, or when he's sick, has fever, those types of things. So I would explain to him that being on lithium, just expect more labs to be drawn after, especially after this toxicity episode, closer monitoring, slower dose changes, and again, regular lab tests. Early warning signs to talk to Bob about would be know what the symptoms are that suggest a high lithium level, and then come in right away. Again, the regular monitoring, plan for blood tests, kidney and thyroid checks, and dosage reviews. And then check with healthcare provider before taking any new meds, even over-the-counter meds or supplements, anything that would affect the kidneys or interact with the lithium. Like some pain meds might do that, NSAIDs can do that, because NSAIDs are processed through the kidneys. Certain diuretics might do that. So just staying hydrated, especially during illness, and doing exercise even, and hot weather. So that's kind of the gist of what I needed to talk about. There was also a question about should lithium be listed as an allergy. So Bob's lithium toxicity was not due to allergic reaction. It was due to direct buildup of lithium from the lithium medication. So it's not a true allergy, but definitely we need to use a lot of caution using lithium if he continues on that path. So that's what I have. Thank you so much, and I'll see you next time. Bye.